Pulmonary hypertension (PH) is a serious condition characterized by elevated blood pressure in the pulmonary arteries, which are the vessels that carry blood from the heart to the lungs. This increased pressure can lead to significant health complications, including heart failure, and it can result from various underlying conditions. Overview: Prevalence: Pulmonary hypertension is relatively rare, affecting about 1 to 2 people per 1,000. However, its prevalence is higher in certain populations, particularly among those with underlying heart or lung conditions. Types: There are several classifications of pulmonary hypertension, based on its causes. Group 1. Pulmonary arterial hypertension POD includes idiopathic POD and those associated with conditions like connective tissue diseases, congenital heart defects, and HIV. Group 2. Pulmonary hypertension due to left heart disease, the most common type, related to conditions like heart failure or valve diseases. Group 3. Pulmonary hypertension due to lung diseases and/or hypoxia, associated with chronic lung conditions like COPD or sleep apnea. Group 4. Chronic thromboembolic pulmonary hypertension (CTEPH) caused by blood clots that block pulmonary arteries. Group 5. Pulmonary hypertension with unclear multifactorial mechanisms. Symptoms: The symptoms of pulmonary hypertension can be subtle and may develop gradually. Common symptoms include shortness of breath. This often occurs during physical activity but can progress to resting breathlessness. Fatigue. Persistent tiredness or lethargy is common due to the heart working harder to pump blood. Chest pain. Some patients may experience chest discomfort, which can be similar to angina. Palpitations. A sensation of a racing or pounding heart may occur. Edema. Swelling in the ankles, legs, or abdomen due to fluid retention. Cyanosis. The bluish tint to the lips or skin, indicating low oxygen levels. Diagnosis: Diagnosing pulmonary hypertension involves a comprehensive approach, including medical history and physical examination, a thorough assessment of symptoms and any relevant medical history, including risk factors like family history or pre-existing conditions. Imaging tests. Echocardiogram, often the first test used to estimate pulmonary artery pressure and assess heart function. Chest X-ray can reveal enlargement of the heart or changes in the lungs. CT pulmonary angiography, useful for detecting blood clots or vascular abnormalities. Right heart catheterization. This invasive procedure measures the pressures in the pulmonary arteries directly and is the gold standard for confirming pulmonary hypertension. Blood tests. These may be performed to assess for underlying causes, such as heart or lung disease, and to rule out other conditions. Treatment. The treatment of pulmonary hypertension depends on the underlying cause and severity of the condition. Options may include medications, vasodilators, medications such as endothelin receptor antagonists e.g., bosentan phosphodiesterase 5 inhibitors e.g., sildenafil, tadalafil, and soluble guanylate cyclase stimulators e.g., Ryosigua 80 help to relax blood vessels and lower pulmonary artery pressure. Diuretics help reduce fluid retention and ease symptoms of heart failure. Anticoagulants, blood thinners may be prescribed, especially in cases of CTEPH. Oxygen therapy. For patients with low oxygen levels, supplemental oxygen can improve symptoms and exercise capacity. Lifestyle modifications. Recommendations may include exercise. Tailored exercise programs can improve quality of life and physical conditioning. Diet. Low-sodium diets to reduce fluid retention. Avoiding high altitudes. Increased altitude can worsen symptoms due to lower oxygen levels. Surgical options. In select cases, procedures like pulmonary endarterectomy to remove blood clots or lung transplantation may be considered. Prognosis. The prognosis for pulmonary hypertension varies widely depending on the underlying cause, the severity of the condition, and how well it responds to treatment. Early diagnosis and intervention are crucial for improving outcomes and quality of life. While pulmonary hypertension can be a progressive condition, advancements in treatments have significantly enhanced the management of the disease. Conclusion: pulmonary hypertension is a complex and potentially life-threatening condition that requires a multidisciplinary approach for diagnosis and management. If you experience symptoms such as unexplained shortness of breath, fatigue, or chest pain, it is essential to consult a healthcare professional for a thorough evaluation and appropriate management. With early intervention and proper treatment, many individuals with pulmonary hypertension can lead fulfilling lives.